Mr. Hernandez. My name is Sonia Sedano. I'm a UCI F&P student. I'll be asking you a couple questions today. What brings you to the office, and performing the examination. Mr. Hernandez, what brings you to the office today?
My back is really hurting.
Okay. Can you tell me, when did this start?
I woke up with it this morning.
Okay.
I called and they gave me the appointment.
Okay, wonderful. Can you tell me exactly where the pain is located?
It's just right here in my low back.
In your lower back?
Yeah.
Okay. All right. Can you describe the pain to me?
It's achy and spasms. Like I get like this sharp pain.
So an aching pain, and then you notice spasms. Okay. Do you have any numbness or tingling down your legs?
No.
No. Okay. Is there anything that makes the pain better?
I'm not moving.
Okay. Is there anything that makes the pain worse aside from movement?
Just moving.
Just moving. Okay. Does the pain radiate? Does it radiate down your legs, or does it radiate up your back?
No.
No. Okay. Is the pain worse in the morning, or in the evening, or is it constant throughout the day?
Well, I've only had it for a day, but it's like in the back, and it doesn't seem to be getting better or worse. It's just when I move.
Okay. Have you tried anything for your back?
No, I just came here to see what you would recommend.
Okay. Can you give me a rating of your pain? 0 being no pain, 10 being the most severe pain that you can imagine. Can you tell me kind of where you fall?
Well, I have a pretty high pain tolerance, so when I move, it's a 5, but I think for other people, it would be close to a 10.
Okay. All right. Fair enough. So what we're going to proceed to do is talk about some of the red flags that we want to be sure that we identify during the course of the examination. So first question for you is, do you have any changes in your bowel or bladder function and control?
No.
No. Have you had any fever or chills?
No.
No. Have you noticed any severe pain that you just can't bear?
No.
No. Okay. All right. So it doesn't seem like you have any of the red flags that we'd be concerned about. What we will do now is proceed with the examination. So I'd like you to hold your hands like this. Perfect.
It's funny.
All right. Great. So we're going to test your strength. If I could borrow your arms, go ahead and hold them out and then pull back. Okay. And then push out. Perfect. And then I'd like you to push your thighs up. Perfect. Can you push your shins out? Perfect. Can you pull your calves back? Perfect. Can you go ahead and do, like if you were pushing down on gas pedals? Perfect. All right. So now what we're going to do is I'm going to have you lay back. Go ahead and just lay back.
Okay. Yeah, it's just like getting to the bottom is.
Okay.
I'm good now.
Okay, you're good. All right. So what we're going to do is test sensation. So does this feel the same on both sides?
Yes.
Okay. Can I have you flex your toe, your big toe, and don't let me bring it down. Perfect. So now we're going to do something called the straight leg test. So I'm going to raise your leg. Let me do all the work. Any pain?
No.
Any pain?
No.
Okay, perfect. So now we'll repeat on the other leg. Any pain?
No.
Any pain?
No.
Okay, perfect. So now what we're going to do is rotation of your hips, and this is to check for arthritis in your hips. I'd like you to bend your leg. We're going to rotate it inwards, outwards. Any pain?
No, just in my low back.
Just in your lower back. Okay, so let's check the other hip. Go ahead and bend your knee, outwards, inward, outwards, inward. Okay, no pain?
Just in my low back.
Just in your lower back. Wonderful. Let's go ahead and have you sit up for me. So if I could have, actually I'm going to be palpating here on your your back. I want to palpate your vertebral column. Have you ever had any back surgeries?
Oh, right there. Right there.
Right here?
Yeah.
Okay.
Yeah, just
Right
lower.
there.
Yeah.
A little bit lower. Okay. How about
Oh, no, I haven't had back surgery.
no back surgeries? Okay. Any pain in your muscles? Let me know if I encounter a muscle that produces pain.
No, feels kind of good though.
Feels kind of good. Okay.
Oh, right there.
Right
yeah.
here.
On
Okay.
the side. Oh, yeah, right there.
Right here.
Yeah, on the
Okay.
right it hurts more than the
Okay.
other side.
The right
sides
side's-
hurt, but the right's worse.
Okay, all right. So what I'm going to have you do is kind of step down for me. Turn this way. Okay, perfect. So what I'm going to have you do is bend forward and touch your toes. Any pain?
Actually, not really. It didn't really hurt too much.
Okay.
Forward.
Can I have you come back up?
Oh, yeah. Oh, there. That
There it
hurts.
is?
Yeah.
Okay. Can I have you bend backwards, please?
Oh, yeah, that hurts.
That hurts quite a bit. Can I have you twist from side to side?
Oh, this
Okay.
way hurts. Yeah. Mhm.
Okay, all right. Can I have you walk towards the wall on your tippy toes?
So if I take little steps, it doesn't really hurt.
Okay. Can I have you walk back on your heels? Any pain?
Mm-hmm.
Okay. If you can have a seat. So through the course of the examination and the questions that I asked you before the examination, it appears that you have a lower back strain, a muscle strain. So what I would recommend at this time is applying ice or heat. It's your preference, whatever seems to alleviate the pain for you. I would recommend taking non-steroidal anti-inflammatories. So what I would do is write you a prescription for 600 milligrams of ibuprofen to be taken 4 times a day. And as necessary, if you feel that you don't need it as frequently, then go ahead and reduce the amount. I'd also like to give you a handout on some stretching exercises that I think would be beneficial. If you could return in 2 to 4 weeks, I think that we could reassess how you're doing, and you can let me know if you're improving. If you're not improving, we can go from there. Do you have any questions or concerns for me?
So you don't come. This is for 2 to 4 weeks.
2 to 4
Don't come
weeks.
back for 4 weeks. I
Yes.
don't need an MRI
Well, at this time,
or an
since
X-ray.
okay, so you're concerned about X-ray or MRI. At this time, because you're indicating that you don't have any numbness or tingling traveling down your legs, you're not in severe pain where it's affecting the quality of life. I wouldn't recommend an MRI or even just a simple X-ray. I think the best thing for you right now is to do the exercises, to stay out of bed, maintain yourself active, go ahead and use the non-steroidal anti-inflammatories, and then return in 2 to 4 weeks. At that time, if you're not improving, we can make the decision to do X-rays, MRI, CT, or even something just like physical therapy. We could put in a referral for that.
Okay.
Okay? So, Ms. Hernandez, my MA just mentioned to me that you had an additional question. What can I help you with?
Yeah, sorry. So I looked at my symptoms on WebMD, and they said sometimes low back pain can be caused by a herniated disc.
Okay.
Are you sure you don't have a herniated disc?
Well, from the description of symptoms that you gave me, the lack of numbness or tingling or loss of sensation in your lower extremity, so basically your legs, it leads me to have a good deal of certainty that you don't have a herniated disc. But I can't be 100% sure. So that's why I recommended that we come back, reassess, reevaluate in 2 to 4 weeks, and then determine how you're doing. So if you start to feel this, the numbness, the tingling, the loss of sensation, or severe pain that you're just not able to tolerate anymore, that's affecting your quality of life, then at that time we would do imaging studies, possibly the MRI that I mentioned on the website, possibly a CT scan, X-rays would be something that we would look into. And then depending on what those results show, then we would decide whether to refer you to something like physical therapy for more of a structured exercise routine that could be developed for you, or we could refer you to orthopedics, surgery, even something like pain management. But we'll cross those bridges when we get to it. For right now, I want to go ahead and use more of a conservative form of treatment. I'm using the non-steroidal anti-inflammatory, so the ibuprofen, the stretching exercises given to you on the handout, and then I'd also recommend the application of ice or cold, whichever one seems to benefit your pain.
Okay.
Okay? So, but please don't hesitate. If you have any questions and concerns, to give us a call.
Okay.
Thank you.
Thanks for coming back.
No problem.